Welcome back to See Live Surgery, the first and only interactive television show seen on @Sports Television Network. We're here at Advanced Ambulatory Surgical Center in Chicago, Illinois. We're going to be performing an anterior cruciate ligament repair. Thank God we have our patient on the table here named Chris. Is the patient sleeping yet? Somewhat asleep here. We're going to start in a few minutes. As you see, I've changed from my suit, and I had a great looking tie on a few minutes ago. I'm in my surgical gear now, and we're going to start the procedure, but first I'm going to take a few questions from everybody. And the color of my tie was not the color of her sock. Was it? Was it that bright? Okay. Let's take our first question here. Are your lips moving? Yes, during this whole procedure here, my lips are moving. Can you see my ears wiggling? My eyes are blinking. You got a good shot of this, Jerry? All right, great. Next question, please. What is the ACL? The ACL could stand for anterior cruciate ligament. Patient's name is Chris. We could be doing an amputation of Chris's leg, but that's not what it's standing for here today. The anterior cruciate ligament is one of 4 major ligaments of the knee. The ACL prevents excessive motion of the knee joint. Patients who sustain an injury of the ACL usually complain that their knee gave out. Right, Chris? Oh, Chris is sleeping. Never mind. Next question. How does an ACL tear occur? We have a great question here from Heather in Phoenix. Hope she's not up too late, not past her bedtime. ACL tear is one of the most common injuries that happen when you're playing sports. It can also happen during rough play, motor vehicle collisions, falls, work-related injuries, but about 80% of the time it's a sports-related injury. These are non-contact injuries, meaning that the patient probably jumped, fell down, got pushed by a wife, boyfriend, no, not really, missed the stair, something that happens when the knee gives out and you feel that pop. And you hear that pop. Do I hear any popping? Is anybody making popcorn here? Pop, there it is. Next question, please. What are the signs of an ACL tear? And this is from Andrew in Seattle. The diagnosis of an ACL tear is made by several methods. First off, did we check his insurance card? Is it okay? It's good? That's fine? Okay, let me continue then. Patients who have an ACL tear often have sustained injuries to the knee. The injury, again, as I said before, is sports-related. They hear that pop. When they have an ACL tear, they have knee instability, they're swelling and pain on examination. So these are the signs. We can confirm them by an X-ray, or even better yet, with an MRI. Next question, please.